All right, so standing reliever is about 6 centimeters, which is normal. I'm going to go ahead and palpate very lightly. Just tell me if you have any tenderness or pain. Feel okay? All right. So I'm going to press a little deeper this time. Feel okay? All right. So go ahead and take a deep breath for me and let it out. I'm going to feel for your liver right up under your ribcage. The liver is not palpable. I'm going to feel for your spleen. Spleen is not palpable, which is good. We wouldn't expect to feel it. I'm also going to palpate for your kidneys. I'll have to press a little bit for this one. So. All right. And kidneys are not palpable, so that's good. We wouldn't normally feel them. And finally, I'm going to palpate for your aorta. Your aorta measures approximately 2 centimeters, which is good. I would expect that. All right, finally, I'm going to check your inguinal lymph nodes, the horizontal and vertical chains. Sorry, I know. So, next I'm going to test your reflexes. So we're going to do your triceps first. Just relax your arm in my hand. Very good. Do your brachial. All right, and your radial. Okay, and do the other side. Very good. All right, and we're going to test your patellar reflexes. So just hold your hands like that. So you know the drill already. All right, very good. Very good. All right, the last thing I'm going to have you do is stand right here in front of me. Okay, put your arms out to your sides. You're checking your balance. Now go ahead and close your eyes. All right, so that's called the Romberg test. It's testing your balance, and your Romberg test is negative, so that's good. Everything looks wonderful. Is there anything else I can do for you?
And there are many ways to do a physical. This is one that I think works well. The registered nurse will want it to be organized, efficient, and thorough. So we're working for a combination of those 3 elements. So I've washed my hands. Katie and I have checked height and weight, which is 5'7", weight is 125. Her blood pressure is 98/60, respirations are 16, and her pulse is 80. Katie, I'm Deb Smith. I'm a family nurse practitioner. I'll be seeing you today to do your 30-minute physical. Do you have any concerns or questions?
No.
Great. During the time that I'm working with Katie, I'll be looking at her appearance, behavior, cognition, and emotions, evaluating her mental status. We'll start by looking at the head, and head is normally proportioned. It's normal cephalic. And we'll just feel for any kind of lumps or bumps or lesions, taking care to look at the scalp for any sort of infestation or any scaling on either side. It looks very nice. And now I'll be feeling the posterior muscles, the paraspinous, right, the parallel the spine. I'll now check for the trapezius, which inserts into the occiput, and feeling the big muscle of the neck here. And then we'll feel for the sternomastoid muscles in the neck. And they feel nice and symmetric and strong. We'll look to see that the trachea is midline and we see no masses in the neck. We'll go ahead and palpate for the carotid. It's 2+ and 2+. We'll then ask you, Katie, to go ahead and open your mouth, checking the TMJ joint. There's a little clicking on this side, on the right side. Now don't let me close your mouth. Checking the muscles of mastication, cranial nerve number 5. Have you bring your tongue over and push me away. Checking cranial nerve 12 on the other side. Good job. And then I'm going to have you lift up your eyebrows. Good. Puff out your cheeks. And smile really big. And nice symmetric movements. So the facial nerve, cranial nerve 7 is intact. have you close your eyes and we'll check the trigeminal sensory. So tell me when you feel me touch.
No. 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 No.
Perfectly intact. Next, we'll look at the eyes. And first, just looking at the lashes, the eyebrows. They're nice and symmetric, and they run the full length of the eye. We're looking at the lid margin, which is symmetric. There's no ptosis. And looking at the conjunctiva, it's nice and white with just a little injection. I'm sorry, sclera is white, conjunctiva is a little injected, and pulling it down to look at its inner side on the inner lid. That's nice and pink. So I'm not worried about anemia with Katie. Looking at the lens and the iris, lens looks clear, iris is blue, and pupils are equal. Katie, we'll just ask that to check your extraocular muscles. So we'll have you watch this in the shape of an H to check each of the nerve and muscles independently, one of the other. So we're checking cranial nerves 3, 4, and 6. And then we'll bring you in to check convergence, and we'll look at your pupils, which should constrict as you look near vision and dilate as you look at far vision. So convergence was bringing the eyes cross-eyed, and accommodation is looking for pupil constriction with near vision, dilation with far vision. We'll then check the cover test with you, and where we're looking for alignment of the eyes and that they're yoked together. So I'll have you look right at my nose and keep looking. I quickly move it away, and there's no movement in the eye that I've covered when I move it, or in the other eye. Neither has to regain vision. I'm going to ask you to read the Snellen test at 14 inches away. We'll have you cover your right eye first. And I always start at 20/20, and then if the patient can't read that, I go to the line that they can read. So would you read those numbers from right to left?
4, 2, 6, 7, 3, 9.
Perfect. And then we'll ask you to switch eyes.
Okay.
And can you read from right to left? Left to right, sorry.
9, 3, 7, 6, 2, 4.
Perfect. Okay, so that would be 20/20 vision. And then let's look at your pupils. So I'll have you look straight ahead, and I'm going to cover, so one eye can't see the other, and we'll look at direct pupil response to light. So the pupil constricts with light and dilates when the light goes away. Now, this time I'm going to shine the light on the left side, but I'm going to check the right side. So not seeing the left side, the right eye should constrict with the left eye response to light and dilate when I pull the light away. That's because the optic nerve crosses at the chiasm and shares that information. We'll do the same thing on the opposite side and go ahead and shine the light in. So there's direct pupillary constriction to light, dilation with removal of light. And then as I look at the left eye, shining the light in the right, constriction in the left, dilation without light, exposure to the right eye, but seen in the left eye. Ears, we're just going to look for alignment. We want the ears to take off from the face at the same line as that which goes from the lateral canthus of the eye to the ear. And we also want that, and Katie has that, we also want the ear to be pretty much straight up and down. It can be 10 degrees list of a straight up and down angle. And Katie is all of that. Looking at the pinna, the skin looks excellent. Always look at the pinna carefully because we see lots of skin cancers on the top of the ear, particularly in men or women that are wearing their hair short so that there's no covering with sun exposure. Few people remember to put sunscreen on their ears. And we'll look behind the ear because behind the ear often there are there's skin lesions and or there can be fissuring, which is very painful, but patients forget to tell you about it. Just going to palpate the lymph nodes with a firm rotary movement behind the ear, in front of the ear, preauricularly, postauricularly, looking for any lymph nodes. Then I'll just be pulling on the ear, asking if there's any tenderness. No. And that tells me that there's probably no infection of the ear canal because that's very tender when that's a problem. We'll check your hearing, Katie. Can you plug this side? Whisper 3 two-syllable words standing about a foot or 12 inches from the patient's ears.
Apple, table, penny.
Perfect. Okay, and then let's do the same thing on this side.
Okay.
And we'll plug that side.
Yellow, Tuesday, soccer.
Perfect. And looking again at alignment, it's well aligned, pretty much straight up and down. Behind the ear, skin is intact without lesions. A little bit of scaling here, but very little. Any pain with this?
No.
So no posterior or anterior auricular lymphadenopathy. And any pain if I pull on the pinna
No.
or push on the tragus?
No.
Excellent. Two other hearing tests that can be done are the Weber. And Weber, you'll set your tuning fork going, place it directly in the middle of the head, ask the patient to tell you to which side it lateralizes or if they hear it in both ears equally.
I think it's equally.
Excellent. And that is a normal Weber. Abnormal would be lateralization to the ear that has the problem. We'll then check Renee, so we set the tuning fork vibrating, ask the patient to tell you when they no longer feel the vibrations.
No.
And do you still hear it?
Yes.
So we know that when bone conduction, she no longer heard through bone conduction, she could hear through air conduction. So air conduction is greater than bone conduction, which is normal for Renee. And one more time, we'll do it on the other side. Tell me when you no longer hear the sound, Katie.
No.
And do you still hear it?
Yes.
Excellent. So perfect hearing.
Okay.
We're then looking at the nose. And we're just looking to see, is the nose straight? And it is. Now, most people's noses will veer off to one side or the other, and that's completely normal. And actually, you'll do it this way.
Alrighty. So no vibration. I feel 2+, as expected. All right. So now we're going to do submandibular in the jaw. If you can just turn over here.
Yes, sure.
Yes. So I can take a better look like this. All right. So we're just going to do the assessment right here. All righty. Do you have any discomfort?
No.
No? Okay. So now I'm going to ask you to open and close your mouth. Again? So that's fine, okay. So I feel no clicking, and I hear no clicking and no popping sound. So that's good. Looks like there's a full range of motion. All right. So now I want to test her cranial nerve number 5, and I'm going to do that by her just biting down. Bite down. All right, I feel it right in there. So that's good. It's intact. Perfect. So now I'm gonna just assess her sinuses. Noted. And I'm just gonna do the axillary while we're over here. I just open this. Stick my hands on it to the axillary. All right. So no palpable nodules. Everything feels good. Any pain?
No, it just tickles.
Okay. Any tenderness?
No.
So, right, so I'm just going to pick that up for you. Okay. And now I am going to just look at me if you can. Visualize her trachea. It is in midline position. Off her foot reference. Okay. So I'm going to do the Babinski reflex by doing the assessment by putting the object and seeing her legs curl in. Okay. So yes, perfect. If you can see the curling, her legs curl, her toes curled in, bend in, perfect, and that's what we're looking for. Okay. So it is a negative Babinski. So next thing we're gonna do is
We're gonna do the position sense. So because you have your feet out, I'm gonna start out with your feet. So close your eyes and you're gonna tell me which position I'm moving your toe. Is it gonna be up or down, okay?
Okay.
Your
Down. Up. Down. Down. Up. Up.
perfect, okay. All right. We're done with that and we're gonna do
Okay. I'm going to start with placing my hands on you. We're going to look at your scalp here and feel for any breaks or lesions or tender places. Anything hurt?
No.
Okay, she has good hair distribution. Her hair is equal, healthy, no breaks in the skin, no subacute crepitus, no apparent infestations. All right. I'm going to look at your pupils here. Her pupils are equal and reactive. Her sclera are intact. No apparent corneal abrasions or deformities, and there's no drainage from her eyes. Her eyelids are equal and conformed. And close your eyes for me. Is this dull or soft?
Dull.
Dull?
Dull.
Dull or soft?
Dull.
Dull or soft?
Soft.
Dull or soft?
Soft.
Perfect. We're going to do her frontal, ethmoid, and maxillary. Any pain or discomfort when I do that?
No.
Okay. Feeling for her lymph nodes. Any tracheal deviation? Can you swallow for me? Perfect. We're checking for her gag reflex, her cranial nerves 9 and 10. All right, you can open your eyes. Thank you. And I'm going to push. Any pain at all? No. Okay. All right. I'm going to have you stand up real quickly for me.
We are going to do a shoulder spica. All right, so for shoulder spica, we're going to start about halfway up the arm, making sure not to get too high because we don't want to get into the axillary area, the armpit. So we're going to start one time around. We're going to do the famous dog ear. Come back around, cover your dog ear. We're going to come up. We're going to get right over here, the AC joint. That's our anatomical landmark. We're going to cover it, go across, come across the front, go around, come across the back, come back over that AC joint, bring it down. Make sure we go down far enough so we're not in the armpit. We're going to come back up over the AC joint again. Back around, make your X pattern, your spica, your figure 8. And we might have enough to go around one more time. There we do, coming back down. Going around, finishing always on the arm. Close off, one on the top. Remember not to make this too tight. One on the bottom. All right, always finish off. Check cap refill. Make sure there's not a lot in the armpit. There's not. How do you feel? Great.
And I'm going to take your temperature. Okay. Can you put this under your tongue for me? All right, and just hold it. Okay, cool. You assess your head and your neck, so you just gotta look, make sure. And your neck and sinuses. So if there's any swelling. And there's not, so that's good. And now I'm gonna ask you to tell me if I'm pulling your finger up or down. Okay. Up, down, down, up. Okay, I'm gonna do it on your toes too. Down, up, I'm gonna write a letter or a number on your hand, and you tell me which one you think it is.
Okay.
A T. A 2. Good job. Okay, this one looks good. See your jaw. Can you open it? Okay, good. It was the same on both sides.
Now we will move into the exam. I'll begin by inspecting the head. Everything looks clear so far, and then I'm just going to palpate, look inside real quick. Everything looks clear. There's no masses, no lesions, no critters of any sort in there. Now I'm just going to palpate your sinuses on your face. So the maxillary sinuses, the frontal sinuses, and then the nasal sinuses all look clear. And they all look clear. Fantastic. So now I'm just going to check your lymph nodes, all right? I'm going to palpate those. So we'll start with the pre node, the submandibular lymph node, and then the supraclavicular lymph nodes, to which are not palpable. So that's good. So all 9 lymph nodes were checked. So I'm just going to take a look at your trachea and feel it. Trachea is midline and there is no deviation. Next, I'm just going to check your thyroid. So if you could swallow for me. Perfect. The thyroid is also midline and
Knock, knock. Provide privacy. Wash hands. Put on gloves. Hi, Terry. My name's Summer. Can you tell me your name and date of birth, please?
Terry Banner, 1-2-32.
Alright, do you have any allergies?
Strawberries, morphine, and penicillin.
Looks like that matches your band. Okay, I'm gonna be doing a head-to-toe assessment on you today, alright?
Okay.
Can you tell me where you are?
I'm at the hospital.
Alright, can you tell me what day it is?
It's Tuesday.
And what brought you in here today?
I had a fall yesterday.
You had a fall yesterday. Are you in any pain right now?
A little bit.
A little bit. Can you rate it on a scale from 1 to 10?
It's about a 3.
About a